This is an Idaho Stars training on recognizing and reporting child abuse and neglect. The learning objectives for this training are that child care providers will be able to define the term mandated reporter and identify the responsibilities associated with being a mandated reporter, recognize signs and symptoms of child abuse and neglect, plan to manage, document, and report suspected maltreatment of a child, and embed protective factors to prevent or respond to child abuse and neglect through a strength-based lens. Regarding child abuse and neglect education, Caring for Our Children Basics states that child care providers will be educated on prevention and recognition strategies. At the end of this training, participants will know when and how to report physical, sexual, and psychological or emotional abuse and neglect, their role as mandatory reporters of child abuse or neglect, and be familiar with Idaho's reporting laws. In Idaho, there is a statewide number, or the Idaho Care Line at 211, to report suspected abuse and neglect to Child Protection Services. Or you may visit the Idaho Department of Health and Welfare website, which provides a list of numbers for each city in each region throughout the state. If the reporting instance is happening in that moment or is otherwise an emergency, call 911. For other criminal reports, call your city's non-emergency phone number, which can be found by searching your city and police department online. The Idaho Department of Health and Welfare designs services to help protect children while providing supports to strengthen families to prevent abuse and neglect. When law enforcement or the Department of Health and Welfare receives a report of abuse or neglect, they will look into the concern, notify the family of the referral, assess the situation, and offer services to reduce safety concerns. If a child needs to be removed from their home for safety, the department works with each family so that the child can return home as soon as it is safe. Whenever possible, children should remain with their family. Making the call to report a concern does not automatically result in the child being removed from their home. Throughout this training, we have embedded frequently asked questions from Idaho child care providers. The first one is, should I tell the parent that I have called CPS or that I am going to? There are times when this is appropriate and unavoidable. For example, hospital social workers often inform parents that a call will be made to CPS, as do some medical professionals. Generally speaking, that is a case-by-case assessment and should be a decision made by the person referring. There is a misperception that only people of certain professions are mandated reporters. However, in Idaho, every adult is a mandated reporter. This includes doctors, nurses, teachers, child care providers, relatives, friends, and private citizens. The time to call is when there is reason to believe that a child under the age of 18 has been abused, neglected, or abandoned. The call should be made within 24 hours of becoming aware of the abuse or neglect. What if you don't call? Failure to call might lead to a child being hurt. In Idaho, failing to report child abuse, neglect, or abandonment is a misdemeanor. The next, and possibly the most frequently asked question is, can I remain anonymous? The answer is yes, you can remain anonymous. You will be asked to give your name and phone number, although it is not required. It gives the social worker a person to call for any follow-up questions that may not have been asked by central intake. You will also need to be ready to provide any identifying information about the child and the family to include names, date of birth, address, phone number, and the school or childcare that the child attends. I'm afraid the parent will find out I called. They'll be angry and confront me. How do I handle this confrontation? You don't have to respond. Call law enforcement if you feel like your safety is being threatened. You do not have to validate that you called unless you want to. If appropriate, you can let parents know that Idaho has a mandated reporter law that requires everyone to report suspected abuse or neglect. If I call, I'm afraid the family will find out and remove their child from my program. This is a very real possibility. Families often make their own inferences and connect their own dots to conclude who made the report. CPS will not validate parents, however. Parents are free to make choices about what they think is best for their children, which includes making a decision to move them out of a program and/or school. That should not be a determining factor whether to call or not. There are 3 different types of abuse distinguished by Idaho for the sake of reporting: physical, sexual, and neglect. Physical abuse means harming a child in a way that leaves physical marks or injuries. Call when you see a child with injuries such as bruises, welts, cuts, bite marks, or broken bones without an appropriate explanation. Burns or bruises that look like the object with which they might have been inflicted. Clothing too warm for the season, which may hide injuries to arms and legs. A pattern of repeated injuries. Or disclosure from the child that they were hurt by an adult. An additional sign of abuse to be aware of in infants is bruising or bleeding of the gums and tissue inside the upper lip, which may indicate forceful feeding. Frustrated caregivers or parents may force a bottle into a baby's mouth, and repeatedly doing so may cause injury. What if I observe a coworker abusing a child? Is reporting different than if it were a parent or guardian? Yes. Reporting is different if it involves a coworker versus a child's family member. CPS can only investigate reports of abuse or neglect by parents or an immediate caregiver, which is a civil matter. For example, if it involves a step-parent, significant other, or grandparent. Whereas if a coworker is observed abusing a child, it is a criminal matter that should be reported to your director or supervisor and law enforcement if there is an injury. Caring for Our Children National Standards identifies specific behaviors which are prohibited in the child care setting. Child care providers are prohibited from intentionally inflicting pain or physical discomfort as punishment, including corporal punishment. Examples include hitting, spanking, slapping, twisting, pulling, squeezing, or biting, excessive physical exercise, rest, or strenuous postures, being forced to eat soap, food, spices, or foreign substances as punishment, or exposure to extreme temperatures. Isolation or restriction are also prohibited in the child care setting, such as placing a child in a crib or high chair for timeout or for any disciplinary reason. Binding or tying the child to restrict movement or taping their mouth is also prohibited. Withholding basic needs is not an effective discipline strategy and is prohibited in the child care setting. Withholding basic needs can range from withholding food or beverages to taking away physical activity or outdoor time as punishment. Exercise and fresh air are regarded as basic human needs. Emotionally damaging behaviors which child care providers may not impose upon children include toilet learning methods that punish, demean, or humiliate, emotional abuse, including rejecting, terrorizing, extended ignoring, or corrupting, or abusive, profane, or sarcastic language about the child or their family. Idaho Stars strives to improve child care in Idaho. The quality of child care for children increases through professional development opportunities with training and education. For more information on effective and recommended practices for guiding children's behavior, visit the Idaho Stars website to find training specific to that subject. Sexual abuse is the use of a child in a sexual way. It may be sexual touching, molestation, incest, rape, or taking pictures of a child for obscene or pornographic purposes. Call when a child has told you that they have been touched in a private place, about having to play games the child doesn't like, that they have to keep something a secret, or someone will be hurt if they tell the secret. Child care providers should take note any time a child displays a pattern of uncharacteristic behavior, such as withdrawal or aggression, or perhaps regression of a previously mastered skill, such as toilet training or bedwetting. These observations are not reportable by themselves, but if you notice a pattern, it's time to pay attention. It may be another piece of the puzzle. Knowing each child you care for is important for a lot of reasons, and this is another, to be able to recognize when something is out of the ordinary. When a child does disclose something of possible concern, providers ask, "What questions should I ask the child, and should I try to find out as much as I can?" The best question to ask when a child discloses abuse or neglect is, "Tell me more about that." Keep asking that until the child has nothing more to add. Do not ask any specific or leading questions, and keep it brief. The less the child is interviewed or asked questions, the better. You should write down what the child says to you as soon as possible while it is fresh in your mind. Should I take pictures? Generally speaking, you should not take pictures. Call CPS or law enforcement right away when abuse has been noticed or disclosed, and then let them do their job. Neglect is when children are not getting the care and protection they need. Call when a child is young and left alone. In Idaho, there is not a specific age when it is legal to leave a child alone. It is subjective to the child's ability and maturity. If a child lives in a house where health or safety hazards are present, while not a top priority for child protection, it may be part of a bigger picture, which, if documented, can provide valuable information. If they have no home or emergency shelter, it is important to note that being homeless is not necessarily an indicator of neglect, but rather a concern especially for older children who have been kicked out and do not have a place to live, or for sanitation issues. Call if a child consistently has nothing to eat, or is without an education, in which a school-age child does not attend school. Recognizing and reporting suspected child abuse, neglect, and exploitation is a sensitive subject and can be stressful. Knowing what to do before it happens is helpful to prepare and reduce stress and uncertainty. A frequently asked question among child care providers addresses uncertainty. "I am not sure. Is there someone I can call and ask questions first so I don't start problems that aren't there?" All offices are staffed differently. Generally speaking, if someone called a local health and welfare office to talk to a social worker, They will be connected to someone who can help them understand how priority guidelines work and what gets screened in and what doesn't. That said, no concerned citizen will be told not to call, as everyone has the right and obligation to do so. What if the child is using their imagination and telling me stories? It is not up to the referent to determine if a child has an overactive imagination. That is up to CPS and/or law enforcement. If it seems realistic, then it should be reported. Sometimes schools or childcares have the requirement for concerned employees to consult with their leadership, such as director or lead teacher or principal, before a report is made, which may help clarify if the information warrants a call to the hotline. A related question is, if there's a mark on the child when they arrive at childcare, should I ask the parent what happened? The answer is absolutely. Children get injured through innocent, realistic means far more than through maltreatment. There may be a credible explanation for what happened to the child. Give the parent the chance to answer. Sometimes their body language and explanation helps clarify whether a report needs to be made. Caring for Our Children Basics states that each program should have a written policy which specifies when, who, and how to report suspected abuse and neglect. Idaho Stars has a form which supports child care providers in the instance a report is made or considered. It can be downloaded from the training website as a supplemental document to this training. You may use it in your program to support following policy and written documentation. A policy should specify that in any instance where there is a reasonable cause to believe that a child has been abused or neglected, the person who suspects it should report directly to the Child Abuse Hotline or Child Protection Services or local law enforcement, as directed in Idaho Code. Knowing what to do to prevent and identify shaken baby syndrome and abusive head trauma will support providers in the unfortunate event it is suspected or encountered. Caring for Our Children states that programs should have a policy and procedure to identify and prevent shaken baby syndrome and abusive head trauma, and all child care providers, including substitutes and volunteers, will be trained on preventing shaken baby syndrome and abusive head trauma. Recognition of potential signs and symptoms of shaken baby syndrome and abusive head trauma, strategies for coping with a crying, fussing, or distraught child, and the development and vulnerabilities of the brain in infancy and early childhood. Idaho Stars has training opportunities to increase knowledge on shaken baby or abusive head trauma, including recognizing signs or symptoms and prevention strategies. Idaho has materials available for families and child care providers to help prevent shaken baby and abusive head trauma, referred to as the Crying Plan. Those materials are available online at no cost. Each program should have a written plan for reporting and managing any incident or unusual occurrence which threatens the health, safety, or welfare of children, staff, or volunteers. A policy for handling urgent medical care or threatening incidents should include management, documentation, and reporting of a lost or missing child, suspected maltreatment of a child, or suspected abuse of staff, volunteers, or family members while on site. Now that we've covered who, when, and why to call, and the call has been made, it's good to know what happened next after the call. Once a call is made and it is substantiated as a priority, someone from Child Protection Services, or the police, or both, will evaluate the situation to determine if there are current and ongoing safety issues. CPS will work with the family to create a plan so the child can stay safely at home. It is very rare for children to be removed at all, and they are usually returned. If the child's safety cannot be ensured, the child may be removed by law enforcement or the court system. It is important to note that CPS does not remove children from their home. Only law enforcement or courts by a judge's order can do that. If the child is removed from their home, CPS is required to work with the child and family toward their safe return. When calling Child Protection Services, first, the caller will speak to a worker with the Central Intake Unit who will gather information and ask questions. The information is recorded regardless of whether it gets screened in or not. CPS has 3 priorities based on the ages of the children and the allegations or reports of concern. If it meets the priority guidelines for screening in, it will get one of the 3 priority designations. How the department responds will depend on the prioritization of the concern. Priority 1s involve planning with law enforcement, and it must be responded to immediately to assess for safety. For Priority 2s, the department must respond within 48 hours, and with Priority 3s, the department has 5 days to respond. When you first call law enforcement to report a crime, you will be talking to a dispatcher. They will get a basic synopsis of the incident and dispatch a patrol officer to get the initial report. The officer will first talk to you to get more detailed information. There are a lot of variables on how the case is handled after that point, dependent on the type of crime you're reporting and the severity. The officer may complete their own investigation, or if it's going to be more involved, refer it to the Investigations Division. Either way, at some point, the child's parents, the child, and the suspect will likely all be interviewed. The investigation could be completed the same day or take a more extended time. When the investigation is complete, a charging decision will be made, which could range anywhere from no charge to a citation to a physical arrest. It's also possible the case could be forwarded to the prosecutor's office for a charging decision, depending on whether it's a misdemeanor, felony, and the nature of the crime or abuse. Sexual abuse or trafficking allegations in which the child is in immediate danger fall under Priority 1. Also, babies and mothers testing positive for drugs or alcohol at birth, as well as life-threatening medical neglect. Reports of children with injuries caused by a caregiver if they are under the age of 6, such as abusive head trauma, also known as shaken baby syndrome. Priority 1s involve planning with law enforcement and must be responded to immediately to assess for safety. Priority 1s can also be children found wandering with no parental supervision or when law enforcement declares imminent danger. It's the immediacy of the threat or danger and age of the child that factor into prioritizing. Child protection does not automatically remove children who are involved in a Priority 1 case. The situation is assessed and a safety plan put in place to keep the child at home. Children are only removed if a safety plan cannot be implemented. Sexual abuse in which the child is not currently with the perpetrator are designated as Priority 2, as well as when a child has been the victim of sex trafficking but is currently safe. Non-life-threatening medical neglect instances are Priority 2. Children who are disabled and unable to communicate are more vulnerable to child abuse and neglect. Parent-caused injuries that are not life-threatening in children over the age of 6 are given a Priority 2 designation, as well as other concerns that do not have immediacy. Priority 3 designations are often moderate medical neglect, court-ordered investigations such as custody matters, lack of supervision, a hazardous home, and educational neglect. Emotional abuse, which is also known as mental, psychological, or verbal abuse, was not mentioned in reporting priorities. That's because in Idaho it is not considered a reportable offense when parents yell or use disparaging remarks towards their children. Sadly, this does happen, even though it is not an effective discipline strategy and is a form of abuse. It is still a prohibited behavior of child care providers as outlined by Caring for Our Children. An exception to this rule is if the emotional abuse has reached the point that the child is suicidal or at risk of harming themselves, and the family does not respond in a protective manner. Then, concerns about emotional abuse would involve Child Protection Services. While we have addressed the process of what happens after a call is made, a common concern is, if I call, will the child automatically be removed from the home? The answer is no. CPS is required to assess all children involved in reports of concern for safety. Most referrals do not result in removal. If a safety threat exists, the child can be removed if there is no way to implement a safety plan or assure the child can be safe. Removals occur when both parents are unwilling or unable to be protective or keep the child safe. Will I have to testify? In child protection matters, it is highly unlikely that a person would have to testify due to the fact that those are civil matters. In criminal matters, it is possible that you could have to testify. In fact, if the case goes to a trial, you would almost certainly have to testify. However, the majority of cases are settled before trial or a witness has to testify. Caring for Our Children states that child care providers who report suspected abuse and neglect in the settings where they work should be immune from discharge, retaliation, or other disciplinary actions for that reason alone, unless it is proven that the report was malicious. Cases which are reported suggest that sometimes workers are intimidated by superiors in the centers where they work, and for that reason fail to report abuse and neglect. In some cases, the abuser may be a staff member or superior. Along those lines, here is another frequently asked question. My director said it isn't something that I need to call on, but I think that I should. Can I get fired if I call anyway? Idaho Code states that any person who has reason to believe that a child has been abused, abandoned, or neglected, and, acting upon that belief, makes a report of abuse, abandon, or neglect, as required in Idaho Code, shall have immunity from any liability, civil or criminal, that might otherwise be incurred or imposed. In addition to Idaho Code having a rule on immunity, also consider that the director may not find out that you did call, and you are not required to tell them if you are confronted. But immunity may be difficult to enforce. According to Caring for Our Children, the National Health and Safety Performance Standards, child care providers should have access to specialized training and expert advice for children with behavior related to abuse or neglect. Children who have been abused or neglected have had their physical and emotional boundaries violated. With this violation often comes a breach of the child's sense of security and trust. Abused and neglected children may come to believe that the world is not a safe place and that adults are not trustworthy. You may remember from other trainings on child development that one of the early developmental tasks of children is to learn to trust their caregivers and environment. Children who have been abused or neglected may have developmental or behavioral issues, which may persist long after the abuse or exposure to violence. Behavioral needs are often misinterpreted by child care providers and responded to inappropriately. The Administration for Children and Families released a memorandum addressing the adoption of evidence-based practices for promoting social-emotional health in young children through trauma-informed care. Workforce supports for child care providers should include training on how to recognize the signs of trauma. Child-focused strategies to promote social-emotional competence are intentional practices integrated throughout the routines of the day. Secure attachment for children and caregivers is a critical component of social-emotional development and supported through intentional relationship-building strategies. Positive behavior management teaches children the skills they need to be successful in a social setting, how to make friends, be a part of a group, and engage in learning. Trauma-informed care means providing safe and nurturing environments with social-emotional learning opportunities to support social-emotional development and competence. Safe and nurturing environments means having secure relationships which are built through responsive caregiving. Predictable routines and schedules mean that children can trust their needs will be met and know what comes next. Developmentally appropriate materials and activities will support a sense of competence for infants, toddlers, and children to be able to explore and learn. Social-emotional learning includes developing a sense of confidence, good relationships with peers and adults, the ability to concentrate and persist even on challenging tasks, effectively communicate emotions, listen to instructions and be attentive, and solve social problems. All behavior is communication. When a child behaves in a certain way, consider what the child is trying to communicate to you. Possible messages behind behavior may include, I am bored, I am sad, I don't feel good, I need attention, I want to play, I am overstimulated. Adults can respond to children's behavior by using effective guidance strategies. Identify the unmet need, redirect children's behavior, and teach children the skills they need to get their needs met. Children who have experienced trauma are at risk of being re-traumatized because they may display challenging behaviors. If these behaviors are responded to with inappropriate discipline strategies or expulsion from childcare, it disrupts consistency and attachment, which all children need, but is especially critical for children who have experienced trauma. It is important to be aware of the fact that children with disabilities are at a greater risk for abuse and neglect. There are a number of reasons why this is true, including the fact that they are more vulnerable and more dependent upon the adults in their lives. Their behavior may be challenging to adults, resulting in inappropriate responses, or the additional stress that a family experiences related to having a child with a disability. Idaho Stars child care consultants can provide on-site support for practicing trauma-informed care. For support with any of the materials from this training, call 211 and ask for your regional Idaho Stars Child Care Resource Center. Child care providers may have concerns regarding language barriers and being able to report. Another frequently asked question is, I know something is wrong and that I need to call, but I don't speak English very well or at all. When I call, will someone be available to translate? The answer is yes, though it may take a little more time. Different resources are available throughout the state. Whether you call CPS or law enforcement, the agency will identify a resource for translation. Reporting and responding to child abuse and neglect can be traumatic from the child care provider perspective too. It's important to identify sources of support and debriefing while maintaining confidentiality. If you have ever flown on an airplane, you probably remember the flight attendant's safety information, in which they tell you about the oxygen masks, emphasizing the importance of putting on your own oxygen mask first before you help anyone else, including children. You won't be any help to others if you are unconscious yourself. This analogy applies to childcare, as you must take care of yourself before you can take care of others. This includes recognizing stressful situations and accessing resources to support you. Caring for our children describes how the physical layout of facilities should be arranged, so there is a high visibility in all areas of the child care used by children to reduce the risk of child abuse and neglect. To reduce risk, all areas, including inside, outside, hallways, diaper changing, and toileting, should be viewed by at least one other adult at all times while children are present. Ideally, each area should have 2 adults at all times. In situations when there is only one child care provider, routines and strategies should be put in place for others to periodically walk in. The presence of multiple caregivers greatly reduces the risk of serious abusive injury. Maltreatment tends to occur in privacy and isolation, and especially in toileting areas. There may be times when someone confides in you a concern they have about a child being abused or neglected, but they are not willing or able to call. Can I report information received to me by another person if I didn't see it myself? Child Protection Services would prefer to get first-hand information, as that's when they receive the best information about the alleged abuse or neglect. However, if someone has informed you about abuse or neglect and they are not willing or able to call it in, it is your responsibility to do so and get as much information from the person as you can and provide it all when you call the Central Intake Unit. The Center for Study of Social Policy has identified 5 protective factors, which are also the foundation of Idaho Star's Strengthening Families framework. Quality childcare can enhance parental resilience by valuing and supporting parents and guardians, assisting with the development of parents' self-efficacy, and linking families to community resources when needed. Provide a place where parents and guardians can develop social connections. Model and teach positive, effective parenting and discipline techniques. And educate parents and guardians about child development and appropriate expectations. Identify needs and connect families stressed or in crisis with community resources. Support children's social and emotional competence by providing children with a healthy, nurturing environment that promotes the development of social-emotional skills. Quality child care programs help prevent abuse and neglect through everyday practices that facilitate friendships and mutual support, strengthen parenting, respond to family crises, link families to services and opportunities, facilitate children's social-emotional development, and observe and respond to early warning signs of child abuse or neglect, and value and support parents. Those practices directly contribute to building parental resilience, social connections, knowledge of parenting practices and child development, accessing concrete support in times of need, and promoting the social-emotional competence of children. The protective factors are evidence-based practices for preventing child abuse and neglect. Please refer to the Strengthening Families resources that accompanies this training. In summary, we have examined who to report as well as who is responsible for reporting, when to report suspected child abuse or neglect, and typical responses from the leading agencies, and what to report when there is a concern. As mandated reporters, child care providers have an additional responsibility to respond to suspected child abuse and neglect due to their unique role in children and families' lives. Quality child care programs intentionally embed the protective factors into practices which help prevent child abuse and neglect. For questions with this or any Idaho Stars trainings, please call your Regional Child Care Resource Center through the Idaho Care Line.